Everyday Heroes is sponsored by the Great Greek Mediterranean Grill and Preferred Home Services.
He is a self-proclaimed country boy, born and raised in Hartsville, South Carolina. But tonight's everyday hero, the first one in his family to go to medical school and become a physician. And though he retired not long ago, he's still finding a way to help others.
So from the time I was in kindergarten, I said I wanted to be a physician.
It's not often someone finds their calling when they're just 6 years old. But Dr. Gerald Wilson says when he got that first doctor's toolkit, he was hooked.
I think it was fated for me to do that.
It wasn't easy. Medical school rarely is. Dr. Wilson, one of 4 black students in a class of 165, but says he always had that drive.
I wanted to be the best I could be, and I wanted to take care of my patients the best that I could.
Dr. Wilson received his medical degree from the Medical University of South Carolina, spent over 40 years in private practice in Columbia. In 2017, recognized as the Physician of the Year by the South Carolina Medical Association and awarded the Order of the Palmetto, this state's highest civilian honor. He admits this industry much different now than when he started.
A lot of the personal touches is being sort of overlooked. And as a general practitioner, a surgeon in practice myself, I was able to dictate the amount of time I needed to spend with each patient. That seems to be lost a bit now, but I think balancing that with the types of services and the quality of services that are being provided probably balances out in the end.
Life after retirement, Dr. Wilson still keeping busy, the retired vascular surgeon and advocate for organ donation, working with this state's organ procurement organization, We Are Sharing Hope, South Carolina. Says there is a need for access to quality health resources in the multicultural community.
Health equity has been a big problem, we know, particularly for minority populations like blacks, Hispanics, and others. And my efforts are to see that we begin to see equity in healthcare. At one time, we were seeing that the number of African American patients who were being offered for transplant didn't really match the number of transplants being done and the amount of disease that was seen in them.
Dr. Wilson says he'll continue to work to encourage people to understand and appreciate the magnitude of organ donation as a life-saving gift and has already seen significant progress.
Fortunately, now we're seeing a much better mix of that. The Medical University has made great efforts in trying to make sure that all patients who need transplants can be equitably offered the opportunity to do that. So I think that's a big plus that I've seen in the past couple of years.
A career spent helping others, not a bad legacy.
I'd like to think that I've had an effect on the health care of not just my population, not just African American people, but an effect on health in general that has made an impact that will be a lasting impact.
Conversation. The boardroom at Sharing Hope headquarters here in Charleston, recently named after Dr. Wilson. Today, more than 1,600 South Carolinians are waiting on the National Transplant waiting list. To nominate an everyday hero, email me at bclark@wcbd.com, or you can go to our website, counton2.com, and hit the Everyday Heroes link.